Good evening and welcome to another episode of Fresh Natural Live. I hope your Monday is going pretty well. Mine has been pretty hectic, to just be quite frank with you. Been pretty busy day to day, but all's well because we have a great show for you tonight. Now, many of you who watch us through YouTube noticed that we weren't on live last week. We had a 7-day ban from YouTube for telling the truth. And so unfortunately, that's part of the landscape these days. Nevertheless, we're back on and we're glad to be back with you. And of course, thanks to you who tuned in on Facebook. We have a great show tonight. I'm going to be talking about the benefits of what's known as intermittent fasting or time-restricted eating. This has been something, a nutritional methodology, I'll call it, that's been looked at in the world of health and nutrition for some time now, a number of years. And, we've used this at Montgomery Heart and Wellness to a certain extent. And however, we really focus on the biochemistry of the food when consumed. And we think that this is probably the most important first step that someone should take when undergoing a nutritional regimen to improve their health. However, it's important to take a look at the whole spectrum of what is being utilized in nutritional science, and I think this is an area that is up and coming. I'm going to review a number of articles with you. It's going to get a little bit muddy, get a little bit into the weeds, but I'm really going to break it down for you because I think we're going to get a lot out of this. And then I'm going to finally talk about how the biochemistry of the food can have a positive impact. I'm going to share some of the data that we have and the studies that we've done and show the findings and compare them to some of the findings that were revealed in some of the intermittent fasting studies. So I think it's going to be an enlightening show tonight. I think we're going to give you some important tools to work with. So we look forward to grinding through the data together. So sit back, get your pen and pencil ready, and I'll see you on the other side of the intro. Hello again. So anyway, what I want to do is start off by discussing a paper that's known as a meta-analysis. And a meta-analysis looks at a number of different studies. And it's important because, this type of research, when you look at dietary interventions, oftentimes the studies are small for various reasons. Our dietary intervention studies, for instance, had about 30 subjects, each person with his own control. We're actually launching another nutritional intervention study, and we're going to have 2 arms of about 20 to 30 subjects. So these are not very large studies where you've got thousands of patients and or thousands of subjects and that's the case for various reasons. These studies are very meticulous. They can be very expensive. In the case of our study, we provide the food for the subjects. In this case, we patients coming through undergoing evaluation. And so the analyses can be very detailed. And so as you expand the numbers, it can be very, very tricky. So oftentimes you will get a series of studies that show an impact, and then statisticians or epidemiologists will then look at the body of data that's published and do what's called a meta-analysis. A meta-analysis when you take a number of studies and of a certain type with similar endpoints and similar interventions, and you try to compile the data of all these studies. Now, the beauty of a meta-analysis is that you help overcome the potential flaw of, say, 1 or 2 given studies. That's one. 2, you try to get a summation of studies that some may have shown a negative outcome, others may have shown a positive outcome. And if you get a balanced amount of these outcomes, then you can say, well, the net, finding of all these studies were in this direction in favor of the intervention or in favor of the control or neutral. So we're going to look at, this approach, this aspect of it, because this gives us a 30,000 square foot approach to what do we know about this concept of intermittent fasting and what effects does it have. Now, most of the studies that looked at intermittent fasting looked at its effects on cardiometabolic risk factors. These are risk factors that lead to diabetes and heart disease, which is very important. And so it was important to see what the outcomes were. The next thing we're going to do is look at different aspects of these studies. So there's another article that in and of itself was a meta-analysis of sorts, but it gave us some insight in terms of the metabolic response of fasting. So it looked at measured hormone levels and substrate levels. So we're going to look at some of that. So it gives us a little bit of insight into the biochemistry of what happens when you undergo fasting, if you will, or prolonged period of time of not eating. And then I'm going to look at the details of a particular study that looked at some men who were pre-diabetic and overweight, and it showed the particular aspects of the findings in this population. So what I liked about this study is that it gave us some detailed findings in a study where there was no weight loss, because most of these other studies showed weight loss. And so there was a consistency of weight before and after. However, despite the lack of weight loss, there was some significant biochemical and physiological changes. But the other thing I like about this study is that it gave us insight into exactly what people were eating when they were feasting. So you have a fasting period. So we pretty much understand what that is. You're drinking water, hydrating, you're not consuming any significant calories. But when you're feasting, what's happening there? And I think that's an important thing for us to look at, because my major critique in this whole body of literature is that little to no attention is made on the particular type of food that people are consuming during the feasting period. And I think that's what's giving us a lot of confusion. And what I'm going to do at the end is I'm going to share with you the data that we have in our clinic, in our lab, that shows the benefits of a specific biochemistry of defined plant-based diet. So if we look at the biochemistry of the food that people are eating, and without any kind of specific time-restricted eating or fasting, we know that the biochemistry of the food has an impact of itself. That's positive or negative. So we can then surmise that if you don't look at the biochemistry of the food, the feasting time could be undermining some of the benefits that you're getting with fasting. And so that may contribute to some of the confusion that we're getting, because one, we're not paying attention to what people are consuming. Some studies may have a healthier diet than other studies. And so studies that have more of a positive effect may have a healthier diet than studies that have a less positive effect. So, so we're going to take a good look at this. So we're going to start diving into this, and I'm going to apologize in advance. I'm going to get a little bit into the weeds, but I promise I'll break this down for you and give you some insight. So again, before we get started, I want you to remember to hit the thumbs up button. If you haven't subscribed, please subscribe to this channel. And of course, share this information with people, because I think this is very important information to empower you with knowledge in terms of how to nourish your body, how to go about eating. And I think I'm going to leave you with some very good takeaway home pointers that you can use once we get through this data, because there is some information, despite the fact that there's a lot of information here and it can get a little bit confusing. There's some summary information that we can pull from this data and some take-home points that I think you can start using right away. That's going to start to impact you. And I'm going to outline these things at the end of this presentation in a final discussion. So without further ado, again, hit the thumbs up button, subscribe, like, share, please, and then do this right now, even while we're on live. Other people can come on and get this information. So I'm going to increase the size of the screen. So anyway, the first study looked at the effect of epidemic intermittent fasting on cardiometabolic risk. Now, this is a systematic review and meta-analysis of randomized controlled trials. Now, again, randomized controlled trials are trials where you get you define your population, and then you recruit individuals who meet that population. So we're going to say, okay, our population of people who are Tex Houston, so congratulations on your badge of courage from the boo tube. Thank you very much, Tex Houston. You get your population, you define your population of people, and you say, okay, we're going to recruit people who are pre-diabetic, who have, high hemoglobin A1Cs or whatever the case is, and this is our population. And so then we're going to recruit that population, and we're going to randomly assign them to either a treatment group or a control group. So that's a randomized control trial. You're controlling the population, and you're bringing them in, and there's a prospective aspect to it typically. So typically, I like to say prospective randomized control trial. We look at this. So now, this meta-analysis did a literature search and sought out studies that did this thing, did a randomized control trial, defined the population, and randomized to one therapy or other. And I'm going to cut to the chase in the sense that this is what they found. So they looked at the literature, and I'm going to actually get into the nuances of what they found, how many articles they studied, etc. But in summary, after looking at all the studies, the composite findings of these studies show that intermittent fasting of different types. Now, I'm going to pause here because intermittent fasting has different definitions, and we're going to outline that. So intermittent fasting had a group of things. Sometimes people fasted every other day. Sometimes people fasted for 2 days in a row. They looked at religious fast. They looked at time-restricted eating. So all of these things fell under this intermittent fasting definition of term or phrases we're using. So compared to control groups, and control groups most of the time was calorie-restricted eating. So in other words, they said we can eat all day long, just got to decrease the calories. They compared that to people said, well, you can only eat in this period of time, and the rest of the day you can't eat, or you have to skip meals for 24 hours. So there's a certain defined period of time of not eating or not consuming calories beyond the usual, say, 8 hours or whatever the case is. And we'll actually, there's an article I have that will show what people's dietary habits were are random. There's some data on that, and I'll pull that article. But anyway, what did they find? Well, with intermittent fasting, there was a reduction in weight. So they found weight loss. They found a reduction in waist circumference. They found a reduction in fat mass. They found a reduction in the BMI, the body mass index. They found a significant reduction in systolic blood pressure and diastolic blood pressure. And they found significant reduction in fasting blood glucose levels and fasting insulin levels. And they also found reduction in insulin resistance in the different studies that they looked at, and also total cholesterol. Now, the composite of all these, again, there was not just one study, there's a composite of really 46 studies, and they analyzed the net effect of all 46 studies. Not every study showed this, but the net effect of these studies is a meta-analysis. So we're looking at multiple studies, the composite effects of what I just described: weight reduction, reduction in waist circumference, reduction in fat mass, reduction in body mass index, reduction in systolic blood pressure, reduction in diastolic blood pressure, reduction in fasting blood glucose levels, a significant reduction in fasting insulin levels, and also reduction in insulin resistance and reduction in total cholesterol. And these were typically people who had increased cardiometabolic risk. They were oftentimes pre-diabetic, diabetic. Many of them were frequently overweight, etc. There were no effects observed on LDL cholesterol or HDL cholesterol or hemoglobin A1C. So again, in this meta-analysis, you saw significant anthropomorphic changes, blood pressure changes, total cholesterol changes, insulin resistance, blood glucose level, but no significant reduction in total LDL or HDL finding. So let's delve into this. Cardiometabolic risk, I mentioned it's an umbrella term. that include all risk factors for diabetes and cardiovascular disease. There are different types of intermittent fasting that act as an energy limiting diet for a specific period, including alternate day, alternate modified day fasting, periodic fasting, time restricted feeding, and religious fasting, as I mentioned before. And let's take a look at this in table 1, because I think it's worth going through a little bit. Alternate day fasting. A circular diet requires fasting for a day and then eating freely for a day. Now, I want you to put a pin in that eating freely part, because that's the important thing as we go through this. And this eating freely is really something that people do throughout all of these. Alternate day modified day fasting is a circular feeding pattern that requires fasting, consumption of 20-25% of energy needs. So that fasting is not a total fast, but a reduction, about a 75 to 80% reduction in your total calories for a day. And then eating freely, again, that phrase is eating freely for a day. Keep a note of that. Now, the popular 5-2 diet includes discontinuous strict energy limit for 2 days a week and 5 other days random eating. And then time restricted feeding as a complete fast for at least 12 hours a day. And there you go again, eating freely the rest of the time. And this is oftentimes 16 hours of fasting, 8 hours of eating freely. And it's the most popular one. You can do it different ways. You can do it 20 hours of fasting, 4 hours eating freely, etc. We'll talk about some of these things, as we go through. So periodic fasting is a circular weekly pattern that consists of fasting 1 to 2 days a week and burning 25% or less of calories required, and eating freely. There's that phrase again, in a week. So you can do a 6-1 or 5-2. We actually have prescriptions where we do prescribe a 5-2, a 6-1, or sometimes a 4-3, and I'll discuss that to a certain extent. And then you have common religious fasts, which they looked at some studies looking at that. The Islamic Ramadan fast, typically during a 30-day fasting period of Ramadan, worshippers fast from sunrise to sunset and eat freely after sunset. Greek Orthodox fast is a fast. During fast, people fast dairy products, eggs, and meat for 40 days. So that's continuously. The Daniel fast, a biblical fast, anywhere from 10 to 40 days, and that's just plant-based food consumption during that time period. And the Jewish fast, one of the major fasts of the Jewish calendar, is in Yom Kippur. And they didn't describe the food there, but I won't get into the details of that. But the point is that I want to give you a flavor, a general overview of what these intermittent fasting protocols were and the different literature that they looked at. Now, how did they do this literature search? And I think it's worth going through this so that you understand, what a meta-analysis is. I'm not going to beat you over the head with the details, but let's say someone does a meta-analysis. What they do is they go to a database of publications. In this case, they looked at 3 databases: PubMed, Embase, Cochrane, Library. And these are databases where you publish your medical literature. It's captured in these databases. And so they did a search, and they looked at about 9,087 articles that had the keyword intermittent fasting or time-restricted fasting, et cetera. And so what they did then is they, screened for duplicates. They found about 1,540 duplicate articles. So they removed those. That left a count of 7,547. And then out of that, 7,441 were excluded. A lot of them were excluded due to the fact that they weren't randomized control trials and various other reasons they didn't meet the criteria. So that then left them with 106 full text articles. So maybe these were not full text articles. Many of them were letters or comments or references made to previous full text articles, etc. Out of these 106 full text articles, some they didn't have data available. So that's 15. Literature review, a case report. They weren't really studies. It was unrelated to predictive factors and related to protocols were not, there. And some were other meta-analysis. So of all these that were removed for those reasons, total 60 removed. That left them with 46 articles that met the analysis. And there were about 55 different arms in these 46 articles. So From these 46 articles from this extensive literature review, what did they find in terms of, what we summarized above? This just outlines what we talked about before: exclusion criteria, as I said before, uncontrolled trials, studies lacking control group, other studies without chronic metabolic risk factors, and so on and so forth. That was the reason studies were excluded. What was looked at was body composition, glycemic control, blood pressure, and lipid panel. I gave you the studies that talked about the different trials that looked at these different parameters. This is just giving you a summation of the studies. Characteristics of included studies. Again, I alluded to before, finally, the 46 articles from the database searches. They were included in the meta-analysis. A total of 2,681 participants were randomized in these 46 different articles. And the characteristics of eligible articles and 55 arms are summarized in another table. I'm not going to belabor this, but let's get down to the results. Now, of body composition, as we said before, it showed a consistent effect of intermittent fasting on weight reduction. So weight reduction of about negative 1.78 kilograms. That's somewhere about 3.5 pounds of weight reduction. There was significant reduction in BMI of about 0.58 kilograms per meter square. From glycemic control, there was significant fasting blood glucose reduction among says. I'm going to go back to this graph in just a minute. Let me get through some of the summaries, and I'll talk about that in a minute. There's a tangible effect on systolic blood pressure and also a significant effect on diastolic blood pressure, as we mentioned above, and a significant reduction in total cholesterol. So these were really the highlights in terms of what the findings were of all the different studies. Let's go back up to this study. This is what's called a force plot. So you may have seen this, if any of you in the scientific world and look at scientific studies, you may see a study plot like this. You got this line in the middle, and you got these little dots or hashes with bars across them. So what do these bars mean? If you were to, and let me just go ahead and magnify this a little bit. Okay, I'm going to magnify this a little bit. So if you look, you see like a dot here. This dot is on one or the other side of this line. You see this little line coming across here. It's a median line. And you see this dot is on this side, this dot's on that side, that dot's on that side. And what you want to look at is one side or the other. This side to the left favors the intervention, meaning that if you had a study with a dot on this side, the findings were consistent in favor of a positive outcome with the intervention. If it's on this side, that means the control group had better outcomes than the intervention group. So you see most of the dots are on the left side, which means for blood pressure, and this A, look down here, for weight, showed a positive. See this dot here, it's not a dot, it's like an open diamond. It shows the summary, it's the average shift. Look at all these dots. The average shift is about here. So that showed a summary positive effect in terms of intervention. So this is the force plot. So what's a force plot? Force plots are one way of summarizing results, reviews results for specific outcomes. So the outcome here is weight loss. And this is a graphical display of individual study results, and usually the weighted average of the studies included in systematic review. So you take a weighted average of all of these groups. Weighted means that you may have one group. So you have one group that's intervention that had like 1,000 subjects, and another group and the control may have had 200 subjects. So the fact that this had 1,000 subjects, gives it more weight than the study that had only 200 subjects that was in the opposite direction. So the weighted outcome, indicates how large the study and the impact the study may have had on the overall database. Now you see these bars here. This is the error bar. So you see, this is the interval, confidence interval. So within this bar is your error. So even though the average was here, statistically it could have been here or here, but it shifted more to this side. So the bigger the bar, the bigger the standard deviation is. The smaller the bar, the smaller the standard deviation. Like this one had a very small standard deviation, and all of it was on the intervention side. This had a very large standard deviation, means that you had some error that could have been on the control side, and a lot that still could have been on the intervention side, more toward intervention than control. So again, the weighted average was in favor of intervention. So that's why the summation of the outcomes of the meta-analysis shows that there's a positive outcome toward weight reduction for intermittent fasting. What can we say about B, which is waist circumference? Same thing here. The weighted average for waist circumference is toward the intervention. So that means the intermittent fasting had a significant impact in reducing waist circumference. Waist circumference is here. C is fat mass. Again, you look at the weighted average here in favor of reducing fat mass. And lastly, if you look at, magnify this so you can't see it all, body mass index, the intermittent fasting had a favorable reduction in body mass index. So very important in terms of the impact of intermittent fasting. And you saw that intermittent fasting included anywhere from time-restricted eating, where you had 16 hours of fasting on a given day, or alternate day fasting, or religious fasting. So there were different studies that looked at these different ways of fasting. This graph, I'm not going to spend too much time on it. This is a funnel plot. Essential what a funnel plot looks at is looking for bias. And oftentimes you can have a situation where only studies with positive outcomes are published. And the way you try to get away with that is that, get around that, is that before you do a publication, you've got to register it with the a database that looks at publications in general. So you get your IRB approval, and then you register your study in a special database where they will then go back and look and see if you've published that study, positive or negative. And so that gives you some inducement to publish whatever you register, because it's going to be looked for. And it's important because if you do studies and you only publish positive outcomes and no negative outcomes, then there's a bias toward positive outcomes. So when you look at this, when you look at on this side of this line, you want to see some kind of a balance. And you can see with weight, waist circumference, BMI, and fat mass, the different studies that looked at these outcomes, they pretty much had a balance of publications on either side of this, meaning that there was less or minimal bias toward publication bias toward these studies, which is very important. And so we can go and now look at similar effects. A was fasting blood glucose and hemoglobin A1C and the HOMA score. Now, if you look at the HOMA score, this weighted average touches the line, so that really wasn't significant. If you look at C, hemoglobin A1C, this weighted average touches the line, so that's not really a significant outcome, even though it trends toward, both of these trends toward intervention. Here with A, which is fasting blood glucose, there's a trend toward the intervention, but again, it still touches the line, and so it doesn't come to statistical significance in terms of intervention. So they didn't find significant interventions in these parameters. And I'm going to talk about that to some extent, because that muddies the water a little bit. Here we look at systolic and diastolic blood pressure. And systolic blood pressure favored intervention, as I said before. So did diastolic blood pressure. So there were positive findings here. So again, I'm not going to go through all of this data. We talked about it. Total cholesterol, triglycerides were good. LDL, HDL were not significant. You can see these touch, and these are weighted averages. Total cholesterol was good. LDL cholesterol, triglycerides were good, but LDL and HDL were not significantly changed. And again, not much bias here. Maybe a little bit more toward positive studies, but pretty much decent balance, and so minimum bias in the study. So the findings of the meta-analysis, and what I think we can safely say is time-restricted eating And intermittent fasting has an impact on weight reduction and blood pressure as well as total cholesterol, but there's some other parameters that are not affected. Now, if we looked at this, is another look. It's a metabolic, it's a meta-analysis of sorts, but they looked at energy metabolism. And the three factors they looked at metabolic adaptations during 72-hour fast. We're going to look at a graph showing that. They look at intermittent fasting effects on cardiometabolic health, energy expenditure, and substrate oxidation. And they look at intermittent fasting, how it could be optimized with exercise. What I'll say is that there was some evidence pointing that exercise could benefit or could be an adjunct, but there weren't a lot of studies that clearly pointed to this. There's also some evidence pointing to the fact that intermittent fasting could enhance energy expenditure by increasing resting metabolic rate. But there were a good number of studies that didn't show positive outcomes and substrate oxidation. Similarly, there was some pointing in positive direction, but not adequate. So I'm not going to really belabor these two factors very much because the water's very muddy. More studies need to be done. What I'm going to do is show you a graph that talks about, illustrates what happens during a 72-hour fast. That's the reason I really highlighted this article. It's a good article that talks about intermittent fasting and it goes to some of the protocols. But what I want to do is give you an overview and then zoom in on some different aspects of intermittent fasting and give you my thoughts, etc. Now, I know we got some questions here. Someone's asked about garlic fasting. I'm going to look into that. I don't know about garlic fasting, but that's an interesting question. So what do we have here? Well, I point out glucagon is one of these hormones, and I'm just going to mention glucagon increases hepatic glucose production specifically. And so really glucagon promotes hepatic conversion of glycogen to glucose. So you want to produce more glucogen. It stimulates de novo glucose synthesis. You make glucose from scratch. It inhibits glucose breakdown and inhibits breakdown and glycogen formation. So glucagon promotes the production and maintenance of glucose so you don't become hypoglycemic. So what happens during a 72-hour fast? You get postprandially. So this, knife and fork and plate represents you eating. So you have your meal here, and right after here, your blood glucose goes up and triglycerides go up. So these are the substrates. The glucose and triglyceride goes up. Free fatty acids go down. Glycerol goes down, and ketones go down to zero. But over time, as you fast from T0 to 72 hours, ketones go up, glycerol goes up, triglycerides come down and somewhat plateaus, but has a downward drift. Glucose comes down, and but it plateaus with a downward drift. Triglycerides stay level, and free fatty acids go up, and so your body goes to a switch, and you start to metabolize free fatty acids over glucose to preserve glucose. And this metabolic switch is important so that you don't become hypoglycemic. And because free fatty acids go up, you tend to metabolize those things. So what happens for hormones? Well, immediately in the postprandial setting, insulin shoots up. So insulin goes up real fast and it comes down. And then glucagon goes down slightly, but then rises up. And so glucagon goes up because you want to maintain glucose levels because you're not consuming carbohydrates. So you're going to minimize breakdown, minimize enhanced production from scratch glucose. Cortisol goes up, epinephrine, norepinephrine. These are mobilizing hormones. These are hormones that mobilize glucose from cells and skeletal and liver cells. So they also help with glucose maintenance as well. So I wanted to give you an insight in terms of what happens in a 72-hour fast in terms of substrate changes and hormone changes that happens over that time period. And I'm not going to get into metabolic prominence, etc. What else did I want to point out in this article? That's the main thing I want to point out in this article, because I want to get into the specifics of another article because there's this study that looked at early time restricted eating. Again, this is one of many studies that were looked at in some of the meta-analysis. But the interesting thing about this study is that they looked at men with prediabetes. And these men were recruited in the Baton Rouge, Louisiana area. And so they were randomized to early time restricted eating. There's a 6-hour feeding period with dinner before 3 p.m. Now, that's the key component, or a control schedule, 12 hours of feeding. They went for 5 weeks and later did a crossover to the other schedule. So you started on one schedule, then you cross over to the other schedule and vice versa. What did they find? Well, they found improved sensitivity, insensitivity. They found improved beta cell responsiveness. They found favorable blood pressure response and reduction oxidative stress and reduction appetite. So all this was found. These findings were had without significant weight loss, and that was an important thing there because oftentimes you attribute, these metabolic findings to weight loss, but in this case there was no significant weight loss, but you still had these metabolic findings. So the control group was eating from 8 a.m. to 8 p.m. The early time emphasized early time restricted feeding. They ate from 8 a.m. to around 2 p.m. And nothing after 3. So they may have spilled over 2, but nothing after 3. And they had extending fasting here throughout the rest of the day. And again, postprandial insulin levels decrease, increased insulin sensitivity, increased beta cell function, decreased blood pressure, decreased oxidative stress, and decreased appetite in the evening. So these are pretty significant findings in the setting of no significant weight loss. And obviously, we want to lose weight, but oftentimes there are individuals who have metabolic, chronic cardiometabolic risk factors who are thin, and weight loss is not something that you want to look at or induce. What's the point here? I want to look at the specifics of what they ate. That was in this study. Hold on one second. I'm going to go to the appendix. Okay, this is important. Again, mealtime interventions. The control group ate from, most of the awake time, and they fasted in sleep time. And so they had breakfast a third, lunch a third, dinner a third. And from about, of course, this says the 7th hour, but from 8 to 8. And so the early times, there's 3 meals in 12 hours, had 3 meals in 6 hours. So they made dinner around the lunchtime hours. So the 3 meals were, kind of compressed in 18 hours of fasting compared to 12. But what I want to emphasize here is, what did they eat? Now, in this study, the best I can tell is that it summarizes much of what's eaten in other intermittent fasting diets, even though I didn't look at all of the dietary breakdowns, but most of them said eat freely. In fact, this could be one of the more, healthy versions of eating, because when you eat freely, especially in some of the religious diets, people eat all sorts of garbage when they've gone without eating. And that's another story, because when you go without eating early on, you say, okay, you can eat between this time and this time, then you may put in a lot of, trash foods, fried chicken or whatever the case is. Here, they had a defined breakfast. And in fact, these people were observed. So, they actually had to go to the research site and consume this food. So it was a pretty, stringent intervention compared to other studies in which case they probably did not observe people eating food or did not provide the food. So this food was provided and observed. The eating of it was observed. So typical breakfast: bagel, cream cheese, tropical fruit, milk, boiled egg, etc. You had whole wheat bread, ham, lettuce, tomatoes, etc. Alfredo pasta with chicken. Day 2, oatmeal, scrambled egg whites, juice, graham crackers. And dinner, it had catfish, almondine, rice, pilaf, green beans, etc. Day 3, waffles, maple syrups, butter, blackberries, boiled egg. You had black bean salsa, turkey. There was animal protein just about every meal, if I recall correctly. chicken salad, et cetera, et cetera. So I'm not going to bore you with the details. You can do a screenshot here. But the bottom line is this is pretty much a standard American diet with animal protein. And they give a breakdown here, 35% fat, 50% carbohydrate, and 15% protein. So wasn't too bad in terms of breakdown of the macromolecules. Some people may argue, a less than 20% or 10% fat diet is better. Some people may argue in terms of fewer carbohydrates and maybe more protein, et cetera. But it was, a reasonable breakdown among the macromolecules. And in summary, what they found, no significant finds in glucose or mean glucose, but postprandial insulin. These little dots say there was statistical significance in these differences. So postprandial insulin was found to be different. Mean insulin levels were found to be improved or reduced. You want to have reduced insulin levels. You don't want to be producing like insulin. Insulin can behave like a growth hormone. It can lead to thickening of blood vessel and stiffening of blood vessel muscles and stiffening of arteries and hypertrophy of the heart and so on. So insulin, reducing insulin is a good thing. Beta cell responses, it was improved, and the early time restricted fasting, insulin resistance was reduced in early time restricted fasting. So these findings were all significant. Diastolic blood pressure, systolic blood pressure was significantly reduced. No significant heart rate, total cholesterol was significantly impacted. Triglyceride was significantly increased in this time restricted feeding period of time. So, which is something that, you got, increased free fatty acids. Maybe some of it's by means of increasing triglycerides, and maybe you're breaking down those components to free fatty acid. And prostane, cortisol levels were not significantly changed. No significant decrease in inflammation. And IL-6 was not a significant change on other things, but the fullness, the sensation of evening fullness was increased in the early intermittent fasting group. So interesting things. I wanted to point out exactly what they ate. Why do I want to talk about that? Because I think, the fact that many of these investigations ignored the essence of the quality of the food that people were eating, I think had an impact. So for instance, if you, we do understand there's some benefits to the fasting state. So if you have a certain time period where you're fasting, whether that's, 16 hours or 72 hours or 24 hours, you're getting some metabolic and physiological benefits. However, when you go to a feasting state where you're eating anything, trash foods that's, triggering inflammation and working against the reversing a lot of these metabolic benefits during the fasting phase, you can really blunt the effects of the overall fasting. So with this back and forth, it's my take that the benefits of the fasting in many studies can be blunted by the poor dietary intake. And since we didn't pay attention to it, some studies may have had healthier diets in the feasting state than others, or people may have eaten healthier by chance. And so you may have, healthier food, like in the study we reviewed, that diet might have been a little healthier than, say, other studies rather, when they didn't observe the people, and people may have eaten, lots of trash, lots of fast food, lots of excess processed carbohydrates, sugars, et cetera, et cetera. So that's why I think it's important to define what people are eating. And so what I want to do with you is share what our intervention has shown. And now this is not time-restricted eating, a metabolic impact on diet. In fact, we let our patients, in this case, eat throughout the day. So they ate ad libitum, meaning they ate as much as they want and ate throughout the day as often as they want and throughout the entire awake period. So what did we find despite allowing them to eat throughout the day? Well, we saw in one study we published reduction in cholesterol and reduction in blood pressure, while at the same time we were able to reduce medications. So the results, significant reduction observed in systolic blood pressure. This is about 16 millimeters of mercury. Diastolic blood pressure, about 9 millimeters of mercury. There was a reduction in serum lipids. Total medication usage was reduced. Weight was reduced. And these p-values, less than 0.0005, that shows that this was very, very significant. The statistical significance is very, very high. And heart rate was reduced. Notice there was no significant reduction in heart rate. Insulin levels were reduced. Hemoglobin A1C. Now, this was intervention only lasted 4 weeks. Hemoglobin A1C is a parameter that's shown to represent an average of about 3 months of blood sugar. Notice most of the studies in the meta-analysis are done on around 5 weeks. So you would say 4 or 5 week studies wouldn't have an impact on hemoglobin A1C. Those studies did not. Ours did. Why did ours have an impact on that? Well, there are 2 things that contribute to hemoglobin A1C. One is the fasting blood sugars over 3 months, but the other one is the fluctuation of blood sugar. So as you have fluctuation of blood sugars, which is oftentimes contributed to postprandial blood sugar findings, then if you reduce those fluctuations, you reduce hemoglobin A1C. So it's my theory that we were reducing those blood sugars based on the fact that the postprandial blood sugars, or the blood sugars increase after eating, were reduced. So that's an important finding. But the other thing I want to outline, which is very, very important, is that in our study, we used the food classification system. So in this food classification system, we define food levels 0 to 10. So not only we define what our patients were eating, we looked at how it's prepared, and how food is prepared has a big impact on the health of the food. If I get okra and eat it raw out of the garden, it's going to have a healthier profile and a more positive impact if I deep fry it and batter fry it or microwave it or whatever the case may be, or if I add a lot of salt and sugar to it or whatever the case is. So, the impact on what goes into the system is based on what the food is and how it's prepared. We promote it. We utilize exclusive plant-based diet. It's minimally processed. And so it was based on this food classification system. I'm leaving this up here so that you can get a screenshot and get an understanding of what that is. I'll show this part as well. That's important. And we plan to do studies with intermittent fasting utilizing a defined plant-based diet. And I anticipate that we're going to get much more defined results. I think the intermittent fasting will have a synergistic effect on a defined plant-based diet. And I also think that will also have a synergistic effect if we even add exercise, because we're going to take away the unknown factor of eating, quote unquote, eating freely during the feasting period, because when you're eating freely, you can blunt the benefits of the fasting duration. And this is very, very important. What else did we find? We also found that we reduced lipoprotein A. Lipoprotein A is an atherogenic molecule that predisposes to heart attacks when you are even if you have normal cholesterol levels. So it's a link to inflammatory markers. We saw inflammation reduce and atherogenic lipoproteins, which I'll go through in a minute. Again, all this was done within 4 weeks. So what did we see? Reduction in Lp(a) by 16% in just 4 weeks, never shown in the medical literature prior to our publication. ApoB, LDL particles were reduced, and small dense LDL cholesterol. So the small dense particle reduction is important because these are the particles that are more atherogenic. These are the particles that can get inside the vasculature and cause plaque formation. That was reduced. We saw a reduction in interleukin-6. IL-6 is a cytokine that has pleiotropic effects. It signals other cytokines. Increased IL-6 can predispose to a cytokine storm, either in the local tissue, say cardiovascular bed, leading to a heart attack or stroke, or systemically leading to sepsis or ARDS in the case of a infection with COVID-19 or something else. We saw a reduction in white blood cell count, which again is a marker of overall inflammation reduction. Plaque 2 is reduced. C-reactive protein, a primary marker that looks at inflammation, was reduced. Again, that wasn't seen significantly in the meta-analysis. So the point is that when you define the biochemistry of the food, and the biochemistry of the food is healthy first and foremost, you can really get an impact on biochemistry physiology that's greater than intermittent fasting if intermittent fasting does not control the biochemistry of food during the feasting time. So when people are eating freely during intermittent fasting, that can really blunt the effects of the intermittent fasting. So oftentimes you may not get improvement in blood pressure, et cetera, because you're just eating trash when you're eating. Finally, what did we see? Well, in case series of patients with heart failure, so these are people with severe illness and beyond what they looked at during the intermittent fasting studies, we saw improvement in cardiac function. It's summarized here in the abstract part. We saw a 92% increase in ejection fraction, 21% reduction in LV mass or thickness or enlargement of the heart. We saw a 62% increase in the stroke volume, which is the amount of blood that's circulated with each heartbeat. There's one patient had a 90 to 95% osteostenosis that regressed, and I'll show you that image. First of all, to summarize the cardiac function, improvement in ejection fraction. So that's the percentage of blood that the heart squeezes out with one beat. That improved. LV mass went down, so the heart became smaller and stronger. Stroke volume went up, cardiac output went up. And so these were, and again, this was case series, so we didn't have a large enough number of subjects to show statistical significance, but we actually have other data substantiating this that's unpublished. So we do know that cardiac function can improve and circulation can improve. And here's an image where the patient came in, she had a 95% narrowing here. And then after about 5.5 months on the plant-based diet, it's minimally processed, the arteries got bigger. This artery is bigger than that, and this 95% lesion is gone. And her ejection fraction went from about 24% to 50%. So just by changing the biochemistry of the food that's eaten, can have a major impact. And it's my thinking that if you add this to intermittent fasting or prolonged fasting period, you can have a synergistic effect of the positive biochemistry of the food and the benefit of the fasting period. And then you can add exercise, we're going to have even more. So what are the take-home messages? Let me do this. I'm going to take a brief break because I know we've gone for almost an hour, but I'm going to answer, after this break, I'm going to answer your questions. And I want to also give you take-home messages. So if you haven't so far, give us a thumbs up, send us some love. Hit the thumbs up button, subscribe, share this information. I think it's going to be very positive information, especially the next segment when I give you some take-home messages. I think if you follow the instruction I give you in the next segment for about 3 to 4 weeks, you'll have a very powerful impact on your life. So some simple steps you can take that I think is going to really impact your life. So if you know some loved ones who are not looking at this now, please share this right now. Have them come on right now in the next 15, 20 seconds. I'm going to give you some information that's going to be very beneficial. I'll see you after the break. Okay, here comes the take-home message. Before I get to the take-home message, I'm going to look at some of these comments. Yolanda asked about why is garlic fasting required in Dr. Sebi vegan diet. I don't know. I mean, garlic has a lot of benefits, health benefits, metabolic benefits. Garlic has L-cysteine and is a precursor to glutathione. So I don't know why garlic fasting is recommended. I'll have to look into that, and I may ask some of my colleagues around. So let's see here. Nighttime is not considered fasting. Geneticists does not allow fasting because ammonia and glycogen issues in the brain. So I'm not sure about that, Abby Doodle. Nighttime is not considered fasting. When we're asleep, we're not consuming calories. At least most people that I know of are not consuming calories. So I think that's a fasting state. And what you do when you wake up and you're not eating, you prolong that fasting state. So you have me baffled on that comment. What's the difference between hypercholesterolemia and hyperlipidemia? Essentially, these are terms that are used interchangeably. Lipids and hypercholesterolemia is a total cholesterol panel, and hyperlipidemia, these phrases are used interchangeably. And then feasting sounds like eat a lot, laugh out loud. For real, though, it does. Feasting does sound like eat a lot. And, we use that phrase feasting, like oftentimes when I'm talking about juice feasting, I refer to feasting as an enhancement of your nourishment. So, but you're right, sometimes people think of feasting as, okay, I'm going to, chow down and eat, 5 hamburgers or something like that, which, again, I see how you can have that interpretation. But typically when I use feasting, I'm referring to an enhancement of nutrients. And so are you eating a better amount of nutrients? But also feasting could mean eating more food and more bad food as well. Anyway, so what are the take-home messages? So the point is this. I think intermittent fasting is good. In fact, what we should do, I prefer the time-restricted eating. So here are the take-home message. One, I think you should consume a plant-based diet. So let's say, for instance, you want to do, if you haven't done your detox this year, here are the detox take-home points. Number one, I think you should go with 100% plant-based diet, preferably all raw plant-based. But let's say you're not there yet. You want to do some steam. You want to do lots of salads that doesn't have, salad dressings with oil in it. You can do smoothies that's not loaded with processed fruits or high glycemic index fruits. So I would do a feasting period or a feeding period, a nourishing period that consists of mostly salads and smoothies. If you're in a city where you have a gourmet raw vegan restaurant, you can get some of the gourmet raw vegan stuff that don't have olive oil. So raw plant foods without oils are key. If you want to have like a soup, a bean soup that doesn't have animal protein or oils, you can add that, but I would prefer eating, if not all raw, mostly raw. So I would say eat your meals. So that's the meals that you consume. So that's the what part. Now, the next part is the when part. The when part is that you should consume food from 10 a.m. to say 2 or 3 p.m. I would say 10 a.m. to 2 p.m., the more aggressive side. If you want to spill over to 3 o'clock, then you can. So I would shoot for 10 a.m. to 2 p.m. And if you spill over to 2:30, 2:45, that's fine, but not a bite, not a drop, not a crumb after 3 p.m., not a bite, not a drop, not a crumb before 10 a.m. So the what? Raw fruits and vegetables only, water, cold pressed juices, smoothies, raw salads for the most part. The most aggressive, you stick with just that. You can do a little steamed soups, a little steamed greens, nothing sauteed, nothing microwave, maybe a little bean soup every now and then. I wouldn't do that every day, but almost all raw. The when, 10 a.m. to 2 p.m. You can spill over to 3, but not later than 3 p.m. To how long? I would say a minimum of 3 weeks. I prefer, say, 6 weeks if you're strong. If you go 4 weeks, that's a good in between. So I would say at least 4 weeks and then up to 6 weeks. If you do this regimen for that period of time, you will see significant health benefits. Of course, always, if you're seeing, if you're on medication, you're seeing a doctor, consult your doctor about nutritional change that you're making, especially on insulin, blood pressure pills. But an intervention like this can work. Some of that said no olive oil, no olive oil, no oil at all doing this. Salad dressing can be made. You can blend some avocados or seeds with greens and herbs and lemon juice or lime juice and water. That can make your apple cider vinegar can be your acidic. You can put soaked dates in your juices. And so let's see here. Can nighttime be considered fasting? Yeah, nighttime can be considered fast. So in this regimen I prescribe, when you eat at 10 a.m. and stop eating at 2 p.m., maybe as late as 3 p.m., then you're fasting from, say, 2 p.m. until 10 a.m. the next day. So let's say from 10 to 2, that's 4 hours of feeding. That means you're fasting for 20 hours during the day. And if the feeding time is a plant-based diet that's minimally processed, all raw or mostly raw, then you're going to detox aggressively. Not a bite, not a drop, not a crumb of any animal protein, not a bite, not a drop of crumb of any processed foods, microwave, fried, sauteed, etc. Hot teas work. Do not add sweeteners to your hot tea. Consume your hot tea without sweeteners. If you want to add some sweet, you have a sweet tooth, you can eat a whole date while you're drinking your tea during the feasting time, but don't eat the date during the fasting time. You can drink the tea without sweetener during the fasting time, but you can't drink the tea with sweetener or with the date. So this take-home message, I think, will be of great benefit to you because it's something that's going to help your body detox. Again, try it for minimum 4 weeks, up to 6 or 8 weeks, and you're going to see remarkable changes. And again, as usual, consult your physician. So I hope you found this information helpful and beneficial. Again, give us a thumbs up, show us some love, hit the like button, subscribe, and share this information with loved ones, friends, even enemies. Help your enemies out too, even though they may get under your skin. So I hope this was helpful for you. And until next time, I want you to keep it fresh, natural, and live.